Each year on the 1st of December, the world commemorates World AIDS Day. People around the world unite to show support for people living with HIV and to remember those who have died from AIDS-related illnesses. To talk to us about this is our very special guest, Sophie Hobbs, who is the Head of Communications for NACOSA. Good morning and welcome, Sophie, if I may.
Good morning. Good morning, Najma. Thank you for having me on.
What is the acronym NACOSA? What does it stand for?
So NACOSA stands for the Networking HIV AIDS Community of Southern Africa. And it was really born out of a movement in the early 90s, which was the National AIDS Convention of South Africa, which was when, a group of activists and doctors, medical professionals, government came together to write the very first National AIDS Plan for South Africa.
Mm-hmm. And since then, how has the institution or organization progressed in terms of your, what you stand for and what you formulated your organization for? Yeah.
Sure. Yes, things have changed quite a bit. We became an NGO formally in 2002, and we started really small, just as really focusing on community-based organizations and networks, and sort of trying to build this movement for HIV. And then we were very lucky to receive funding from the Global Fund, and again from PEPFAR, another one of the big funders. And so we've grown really exponentially since then. And we now are quite a large grant manager, so we manage big grants on behalf of those donors. But we're still a network, and we're still, very much focused on the community response to HIV. So while we're a big organization now with a large footprint across the country, we started quite small, just in the Western Cape. We're now, big and national, but we're very much focused on the community response and the civil society response to HIV.
Right. So at one stage in South Africa, it was a pandemic, of course, and all our antennas were up. Everyone was
Yeah.
listening, watching, creating awareness, fear, all of those things happened at one stage. And now we've made progress, right? But do you think that we just, because there's help available, there's medication available, there are,
Mhm.
support, there is support that has actually made quite a difference. And for that reason, maybe we're talking about it less.
Yes, I mean, I think that's a very good point. And the pandemic, it's still a pandemic, but it's changed. It's changed, and the medicines that we now have to treat HIV has turned it from a kind of death sentence into a chronic disease, more like having diabetes or high blood pressure. And you're right, it has taken HIV off the headlines, as it were, because we're not seeing in communities, the young people that we work with say, we're not seeing people dying of AIDS anymore. It's not a problem anymore. So the challenge is really for us to keep on track with HIV, because if we want to end AIDS by 2030, which is the UNAIDS, the global and South Africa's aim and target, we actually have to still focus on back to basics, on prevention, on getting people onto treatment, on making sure everyone gets tested, and making sure people stay on treatment. Because I think a lot of South Africans don't realize, or a lot of people don't realize, that if you are HIV positive and successfully on treatment, in other words, you're taking your ARVs as required, and your viral load becomes undetectable, you can't transmit HIV onto anyone, onto a loved one, or onto anyone. So it's actually people being on treatment is actually a form of prevention in South Africa. So really, our role is to get us to that final step. Yes, we've made great strides in HIV from treatment, but also from a community response. People caring for those living with HIV. But I think, to get us to the next phase, which is really to see an end of AIDS, is we all really have to really focus on getting to the final stage in it. And the biggest thing around that is stigma. So there still exists a great deal of stigma around HIV, and that is probably the biggest factor, preventing people from being tested and getting onto treatment, and then, being able to live an almost normal life, an almost normal life expectancy with HIV.
Mm. Well, you just touched on the point I was going to make regarding stigma and ask. I wanted to know, have we actually overcome that? I don't think we ever will, but has there been a change, and why still such a big secret when it's out there?
Yeah, no, I think we haven't managed to overcome stigma, unfortunately. I think it's partly due to the fact that in the very early days, HIV was something that affected what we in the response call key and vulnerable populations, but those groups of people who are really on the margins of society, and that is still the case. So it's very heavily impacts on people who live on the margins, and that has led to a great deal of stigma around the illness. We don't see the same stigma around diabetes, for example.
Mm-hmm.
HIV and AIDS has this huge, heavy burden of stigma, and it's partly historical, but it's also that HIV is one of these diseases that is a perfect storm of disease. In other words, it's a lot of different factors that are affecting it. So, like things like poverty and inequality and lack of inequitable access to services, criminalization of certain groups of people. That means that they are further stigmatized and further excluded from services. So at NACOSA, we really want to help people understand, help communities understand that stigmatizing groups of people or judging groups of people, certain groups of people, doesn't help the HIV response. In fact, it makes things worse because it drives people into the shadows further, and then they can't access the care, and that actually impacts on the progression of the disease and the spread of the disease in communities.
Mm-hmm. After the break, we can talk about testing and how discreet can it be so that people can be more comfortable in going to get tested. Thank you, Sophie.
Great, thank you.
This is Salam Media. Salam Media, a global voice for humanity.
Thinking about Turkey, Syria, and all affected areas. Turkey just woke up yesterday morning. We just woke up in a very bad day. Like 10 cities, like it's a big part of the Turkey affected by the earthquake. According to authorities, 11,302 buildings collapsed. More than 500,000 people were living in these buildings. I'm from the region. I'm from the Hatay region. My hometown just collapsed and thousands of people under the buildings, and they didn't have any rescue team over there yet because it's a huge earthquake, and Turkey just called all the world because we are not enough for one cities, two cities, but just 10 cities. Buildings collapsed.
Aisha Gul Aral, she is based in Turkey.
Salam Media, a global voice for humanity. Listen to something fresh.
If you listen to various statements from national level, province, until regional and branch level, there's consistent tone of immunity. This clearly says to you that it's a contestation of leaders not necessarily implemented the new ANC, but actually would want to claim that are in the ANC. You have elderly who still are staunch supporters of them, but you then have the emerging generation who believes in track record of a party in order for them to support them. So speak renewal, but you then have to keep that in particular, thinking that, remember, we have much more of a younger than an elderly generation.
Dr. Beng Maseng.
Salam Media, a global voice for humanity. Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Sophie Hobbs is our very special guest at this hour on News and Views this morning with Najma Kota. Right, we're talking about World AIDS Day, and before the break, the question was on how have we improved ways to test so that it can be more discreet and more accessible to people.
Yes, we've also made great strides on that front across the years in the HIV response. What's fantastic now is that you don't have to go to a clinic to get tested. There are many community organizations, such as the organizations that we work with, organizations in our network and in our implementing partners, who have mobile units that go around and do testing. And you can go to an NGO and get tested. You don't have to, go into a clinic where, there's no such thing anymore as the AIDS Day, when people, could stigmatize you for being at a clinic or for getting tested. There's lots of events. And there's a fantastic new oral test. It's actually not that new, but new in, I suppose, in the greater scheme of things. And it's literally a stick that you put in your mouth and you wipe it around your mouth. It measures the presence of a protein in the saliva. And you can get those tests again from many of the NGOs that we work with, many of the organizations, the community-based organizations, and you can actually test yourself in the safety of your own home, in the privacy of your own home. It's called a screening rather than a test. So, but the instructions are very clear, and you can actually, you can take the test, and then if the test comes back positive, you will go in and have a confirmatory test. So, but that is really, it's a fantastic, private, painless, you don't need a finger prick anymore, way to test for HIV, so that everyone can know their status, because knowledge is power. So knowledge of your status will enable you to get, first of all, if you're HIV positive, get the treatment you need to make sure that you stay healthy and you can live a normal life, but also crucially to make sure that you don't transmit the virus onto anyone else. So that is the key thing about getting onto treatment. Well, one of the key things is obviously to stay healthy, but also to reduce the spread of HIV, and then that will help us get to that final mile of an end to AIDS, hopefully, within target by 2030.
Sophie, what comes to mind is there are so many different ways of contracting the disease, right? And it's obviously stigmatized because of it's a sexually transmitted disease. However,
yes, yeah,
one does get medical professionals that have this needle stick injuries.
yes.
What of blood transfusions? How safe is that screening process?
Yeah, so I think blood transfusions in the early days of HIV was a major thing. Not so much in South Africa, because we don't pay people for blood. So and we've never done that as a country. So I think our blood transfusion services are exceptionally safe, and it's very, very unusual. And very, very rare for there to be any. In fact, it's not something we deal with at all. I haven't heard of it for the years. I think in the early days, before they realized, quite how the virus was spread, that was a problem. But our blood banks and blood transfusion services in South Africa are exceptionally safe, and they're very well tested and screened. And I think your point about needle stick injuries is a good one, because there are times, yes, it's a sexually transmitted disease, but there are times when, like, for example, in the instance of a needle stick injury or in the instance of sexual assault and rape, you can get, if you get to a clinic or a medical facility within 72 hours, there's medicine that you can take that will prevent you from contracting HIV from that, either that injury or the sexual assault. And so it's important to get that message out as well to people, that they know to get to a medical, to get care within 72 hours, you can take something called PEP, which stands for post-exposure prophylaxis, which is a medicalized term. But basically, it just means it's some ARV, some antiretroviral medication that stops the virus in its tracks before it even has a chance to take hold in the body. So that's another really critical thing, and a critical weapon that we have against HIV, a tool that we have to prevent HIV in those instances. But yes, it's sexually transmitted, and it is also transmitted by, sharing of needles, and any kind of sharing of blood, but not bodily fluid. There are other sexually transmitted infections that are transmitted in other ways that are easier to transmit. That's why condoms are so great, because they prevent HIV, but they also prevent unwanted pregnancy, and they also prevent other kinds of sexually transmitted infections that are easier to contract. HIV is actually quite hard to contract. It's one of those, it's not like COVID where, you cough and you get it. So that's why we do have the tools to be able to prevent it now, which is fantastic.
Mm-hmm. So what is the slogan for World AIDS Day in 2024?
So the theme for World AIDS Day in 2024 is equal rights, equal care. And I think that's very much talking to the point about stigma, that everyone should get access to care for HIV, that everyone should enjoy equal rights, and that by ensuring everyone has equal rights, we actually then ensure equal care. So it's one good thing leads to another, and that will help us to end AIDS.
So we find that these inequalities hinders the progress in the fight to end AIDS, right? So we really have to,
definitely.
It's a long road ahead, but I think you have made progress nonetheless.
Yes, we have. And it's something as a country we should be proud of. There was a massive movement of civil society activists that came together and really drove, on a global scale, drove access to affordable medication for HIV for the country. And we should be proud of the achievement that we have made. We have the world's biggest ARV program. However, we also have the world's biggest HIV burden. So there are areas where we're not doing so well. One of those is what they call vertical transmission, so the transmission of HIV from mothers to their children. Very much, again, driven by stigma, by inequality, by lack of access to care. Gender-based violence is still a massive driver of HIV in South Africa. Young women in particular are at very high risk. But we do have the tools now to be able to drive down that risk and to be able to ensure that young women can protect themselves and can get the tools they need to stay HIV negative and fulfill their potential as South Africans.
Right. What's interesting is that, it's a matter of educating and conscientizing people, because not everyone has access to information, unfortunately. We just take for granted because, we have access, so we think everyone knows what we know.
Yeah.
But we've also seen this drive in the education system, where one of the subjects actually has the topic on HIV, and there's a full discussion, lessons on it. Has that made a difference at that level? Because we could have those learners going home and talking about it to their families, and hopefully that would spread the awareness as such.
Yeah, that's a really good point, and something again that as a country we can be quite proud of. We have a very progressive, comprehensive sexuality education program in schools. It has been quite controversial because I think parents and communities can feel, if we're talking about sex with our children, then it's teaching them about sex, but actually what it's teaching them is about how to protect themselves. And I think that, yes, it is making a difference, and young people are, getting switched on to how to protect themselves, how to be safe, how to, prevent HIV. And as I said earlier, the more you drive the kind of thing underground, the worse it actually gets for people, and the less people can have access to it. And I think we have to, in South Africa, in our country, there is still, massive inequalities, where some young people just don't have physical access to services. They're living in very poor communities. So the education system and schools are one way that you can really reach the majority of South African young people, and to help them with understanding and to give them that knowledge. That knowledge is power. So we're working very closely with the Department of Education, and they're a great partner with us to try and actually get even more services into schools, HIV self-testing, for example. So it's a long road, and we do have to battle with community and parental attitudes. And it's our job really to help convince communities to understand that the more we know, the more young people know, the better they are equipped to protect themselves.
Right. And lastly, what are the latest statistics for South Africa 2024?
So the latest statistics that we saw, I don't know if I've got 2024's statistics because they often lag a few years, but we're looking at around 8 million South Africans living with HIV. And the worrying one with that is there are around an estimated 2 million of those people who are not on treatment. So around 2 million people living with HIV who are not currently on treatment. So that's a really, that's something that we can really do something about. I know the Treatment Action Campaign has recently called on the government to make sure that people can get 6 months worth of treatment from clinics. So they don't have to keep going back every 3 months. They can actually just get 6 months. And then there's a new HIV treatment, which is a new injectable treatment, and an injectable PrEP, which is pre-exposure prophylaxis. So that's something like you would take malaria tablets to prevent you getting HIV. And there's also an injectable one that's coming. So the next big push for us as a country will be to ensure we can get access to those medications which were tested in South Africa, and one of them found to be almost 100% effective, which is an incredible statistic. And one of the big pushes for us to get those affordably, so to make sure that the drug companies provide those treatments which they tested here in South Africa, to provide them to us and to our government, so that we can buy them that they are affordable, because that would be a game changer. If you only had to go to the clinic once every 6 months for an injection to prevent HIV or to treat it, it would be a game changer.
Thank you so much, Sophie, for your time this morning.
Thank you. Thank you very much, Najma.
It's a
And you
pleasure.
too. Thank
Bye.
you. Bye.
All right. Our next guest is also standing by. And since we've had a bit of a change in our schedule, uh, as per our script this morning, we're very happy and pleased to say that we are connecting now with the Syrian journalist, not the one we were going to connect with earlier. So after this break, I'll tell you more about who we're talking to live out of Syria.